And welcome back to the Wellness Paradox podcast. I'm so grateful that you can join us on this journey towards greater human flourishing. As always, I'm your host, Michael Stack, an exercise physiologist by training and a health entrepreneur and a health educator by trade. And I'm fascinated by a phenomena that I call the wellness paradox. This paradox, as I view it, is the lack of interaction and communication between fitness and wellness professionals and our medical professionals. This podcast is all about closing off that gap by disseminating the latest, most evidence-based, and most engaging information in the health sciences. And to do that in episode 24, we're joined by Thomas Hammett, who's a physical therapist. But as you're going to find out, he's not your typical physical therapist. He looks at the role that exercise and lifestyle plays in treating the whole person. That whole person concept is something that's going to come up numerous times during our conversation. And it harkens back to conversations I've had with Kate Collins from the American College of Lifestyle Medicine, Tom Rafai in our very first episode, David Katz. It seems like a very common thread that we pull on in the wellness paradox universe is this idea of treating the whole person. And the exciting thing about this discussion that I'm having with Thomas is he talks about the intimate role that an exercise or fitness specialist plays in the physical therapy process. In fact, in the clinics that he works with, the first person that their patients meet with is actually an exercise specialist. I didn't know that going into our conversation, and it literally knocked me back in my chair. So I think this is a great conversation and a very inspiring conversation for exercise and fitness professionals to understand where a potential inroad is in the healthcare delivery system. And I think this is a very viable pathway if we take some of the advice that Thomas provides in this episode. Any additional information that we'd like to share in this episode can be found on the show notes page by going to wellnessparadoxpod.com/episode 24. I hope you enjoy this conversation with Thomas Hammett. Today, we're delighted to be joined by Thomas Hammett. Thomas, thank you so much for joining us.
Yeah, thanks for having me, man. I'm excited to be here.
Absolutely. And we have our mutual friend, Jeff Young, to thank about this. He was the person that put us into contact, and I'm excited to have this conversation on the heels of some of the things that we talked about with him, as well as some of the other guests we've had on the show. And I want to get right into it, just giving our audience a little bit more of an understanding of your background, just to provide some context for our conversation.
Yeah, absolutely. And first off, I'm a huge fan of the podcast so far. I spent quite a bit of time over the last few weeks listening to some of your recent episodes, and just really incredible conversations you've been having with people around this idea of the wellness paradox and human flourishing. So it's really an honor for me to be here. So I'll share a little bit about myself now. I'm a physical therapist in practice. So I started physical therapy practice about 5 years ago, graduated from Duke University, where I got my DPT. I have a pre-PT background in kinesiology, and really got some of the fundamentals in exercise and fitness, and didn't find that to be something that I thought was tremendously special about myself until I got out into practice. I started practice at this really incredible company called Pinnacle, which at the time was a small private practice group that was starting to get integrated into hospitals and medical systems. So the fundamentals where Pinnacle started was as a traditional PT practice that really began developing more of a lifestyle medicine mindset of taking responsibility for more than just the acute injury, or what people believe to be the acute injury, in presenting to physical therapy care, particularly in an orthopedic setting, and having conversations that went beyond just the injury itself, having conversations with people about health, starting to help people and guide them towards behavior change, having conversations about health vitals, and really taking that on as a responsibility of my practice, which was a lot different than what I had learned even in PT school, which I think you and I will probably get into a little bit more today in our conversation too. But I got to start at this company that was doing things a little bit different, that really challenged me to think differently about what my role in practice was and develop some practice patterns that have helped me into a next role, which really is what I serve as today. Our Director of Clinical Services. Pinnacle now is a consulting and management group. So I'm really doing consulting and management for both hospitals, private practice clinics, so physical therapy or nutrition or both. And helping really the practice of lifestyle medicine. When we think about the therapeutic practice of helping people make nutrition behavior change, helping coach people towards moving their bodies in healthful ways and reducing the barriers to movement, getting people connected with quality exercise programs. That's really the work that I do now in my consulting and management role. And like I said, I'm just psyched to be here talking with you today, Mike.
Awesome. Yeah. Thank you. Thank you so much. And it is interesting. We've had several guests on as of late that have spoke of lifestyle medicine. We had Kate Collins, who's the current president of the ACLM on. We had David Katz in one of our early episodes, who's very much almost the founder of the lifestyle medicine movement. Tom Rafai in our first episode, part of the ACLM. And it's interesting because when you think of lifestyle medicine, you often think about it from the physician perspective, but you're talking about it from a physical therapy perspective. And I find that interesting. What is your perspective on where the profession is as a whole in terms of viewing lifestyle medicine as a viable modality? And I ask because I don't hear it talked about very often in PT.
Yeah, it's such a good question. So I think there's a lot of intrigue, and it's not necessarily a new idea that PTs who can help people get moving again could be really effective providers in that general lifestyle movement. I'm a part of a section of the American Physical Therapy Association, the private practice section, and even on a business side, because those are the people that are really interested in how can we move the business of physical therapy to be more effective. Thinking about how we can integrate the nutrition side of things, the exercise side of things, keeping people engaged for longer. Our practice model as physical therapy, frankly, isn't the smartest, where we'll see people for 6 to 10 to 12 times and then say, see you later. And we celebrate when you leave and tell you never to come back. So there's a lot of people that are interested in the idea of how can we engage people for longer? How can we be a part of the overall health picture and engaging our clients, the people that seek care from us, that build trust in us as people that they spend a lot of time with. How can we help them get more out of that experience and start to make more changes as a result of being engaged in the medical system? And where that falls apart, I think, is how, right? Like, there's a lot of people that believe in that message. But when we talk about barriers, a lot of it is that it's not currently modeled in practice, or at least not modeled consistently. There's a lot of, I think, therapeutic lifestyle or holistic wellness type medical practices that have several providers, groups of providers, physical therapy being one of them within the clinic. But how that comes together to actually make therapeutic lifestyle change is inconsistent at best. And it's something that I think is emerging in our field, something that I feel super passionate about. There's a few people that in our profession, Janet Besner is a name that I'll just drop right now as someone who's been writing about our role in this for a long time, that have the foresight to see our role in this, and that we just need to do a better job in practice of consistently upholding. And really that's what I'm interested in doing in my current position, is helping PTs learn how we can do that. It's not a new message, but it's a new way of thinking how we practice. So, yeah.
Absolutely. And you said it. It's not a question of if this is a good idea. It's a question of how do we actually operationalize this idea into practice. And not that I think we're going to come up with all the answers in the next 45 minutes or so, but
sure.
I do want to talk. I do want to get into that a little bit. But before we go there, before we go down that really complex rabbit hole, I just want to level set a little bit more with where your passion comes from for this. I think most people, they get into physical therapy, and I'm generalizing here, they get into physical therapy and people are going to come to them injured, and they're going to fix their injuries and get them back onto normal life and normal function. You seem to have a more broader perspective, almost that of a fitness or a wellness professional. Where does that interest and passion come from for you?
Yeah, man. I wish that there was one source that I could just point to and say, Mike, this is where it started, man. But I'll tell you a couple of stories that I think really help to illuminate why I feel a sense of urgency about this.
Mm-hmm.
So the very first client that I saw in private practice as a licensed PT provider. So I don't have a clinical instructor following me around anymore. This is real deal practice for me now. He came in with a diagnosis of frozen shoulder, had multiple carpal tunnel surgeries prior to seeing me, which wasn't really associated with the frozen shoulder kind of thing he was dealing with, but he was really frustrated with that. He gave me some pretty intimate details about his life, like what was going on with him. And, at that point, as a new provider, I was really willing to listen and hear his story. I think it's one of the things that you lean on a little bit as a young provider is like, how can I learn about this person to build therapeutic alliance? Because I don't know all the skills yet. Mm-hmm. And I learned a ton about his story. I spent a lot of time with him. He came into the clinic 10, 12 times to work with me on his shoulder and continued. He ended up actually seeing occupational therapy after me because he had some carpal tunnel stuff that he was still dealing with after having the surgeries. And my point with telling that story, I worked with him for, I don't know, maybe a total of 10 hours. I spent a good amount of time with this man. Mm-hmm. And, about a year and a half after that first encounter with him, I saw him rolling out. We actually in that clinic were directly attached to an orthopedics clinic. And I knew that part of his medical comorbidities was a diagnosis of type 2 diabetes. At the time, I didn't really understand how that played into the whole picture of his care. And frankly, wasn't super confident about counseling about type 2 diabetes. I knew enough about it that I could have a conversation, but really wasn't at a place where I was ready to have the conversation with him about it. I was ready to work on his shoulder, and I saw him roll out a year and a half later after that plan of care from the orthopedics office, and he had a below the knee amputation. And he was telling me, at the beginning, when I look back on it, it's so crystal clear to me. He was telling me all the things about, how he couldn't manage his blood sugar and didn't have the support that he needed and was working too much and couldn't make these changes. And again, he was there with me for, like 10 hours. I spent a lot of time with him. And it's not for a lack of trying. I just didn't know what to do to help move this man along to start making meaningful change, to start taking those baby steps. And, that story for me is not necessarily like I'm hard on myself about the past, but really what a learning experience to look back on and think, like if I would have known the support as a provider, if I would have had that chance. There's all kinds of people like that, whether it's that or we see them again for a different, orthopedic issue, that they're more prone to other things happening if they're in a state of chronic disease. And that we just don't, as PTs, I ended up treating a shoulder and not the person. And yeah, it's too bad. But I think in practice, we all endeavor to treat the person. What we know how to do is treat orthopedic body parts, unfortunately. And there just needs to be a how for the rest of that. It's not that I didn't want to do better. I just didn't know how and didn't have the scheme and paradigm to do it. So, that was really the kind of the most monumental situation for me that's left me with lasting impacts. But then any of those patients that, I saw them one time for X medical issue and 6 months down the road, they're back. And it's something else that they're dealing with from a pain perspective, and they haven't changed their behavior. But it'd certainly be a different story if they were more physically active than the last time that I saw them. But people discharge from PT, they wipe their hands clean of that home exercise plan, and they continue with their lives until something else comes out and jumps and bites them, and they got to go back and deal with the PT again. And I can't help but think if people were being more preventive, if we were helping get people more resources and how to be physically active or make the changes that they're even ready to make when they present to PT, the things they're already saying to us, that's the stuff to me that I think I can help people make a change in and what I'm passionate about. And it's really from that practice experience. So, yeah.
That's a very powerful story. I think that's I think our stories make us who we are, and you don't forget something like that. I can only imagine the shock on your face when you saw that. It's not as if he, had gained 20 pounds or something like that. He lost, part of his limb, and it has to be a pretty significant inflection point. Thanks for sharing that.
Yeah.
So as we dive a little bit deeper into this, I'm curious where you see the barriers to this becoming a reality. And I think that's a good place to start. And then we'll kind of follow that thread to how we can start to overcome those barriers. And then finally, where fitness and wellness professionals play into this entire paradigm. But let's at least define some of the barriers up front before we move forward.
Yeah. So, and that, I think, certainly even thinking about integrating fitness and wellness professionals it's one of the barriers that we can touch on, like you said, a little bit later. I think just to start with, so one of the things that I think people who interact with me when I get started on some of this stuff, I think they think that I'm a little bit too focused on our roles in medicine, that I spend too much time trying to make sure that people understand what it is that we do in our expertise to play a part in this bigger picture. I really think that right now the physical therapy profession has a role definement problem, that we are not super good at being able to tell people in 30 seconds or less what it is that we do well to serve society. I think some of that is that there's, I think, a number of reasons towards that too, but that we really were founded out of this acute care mindset that, physical therapy in the United States started to serve a population of people that were really people who were pulled out of war, that had war-related injuries. And then the other side of it was developed to help manage the polio epidemic. And, our practice is developed from a place that we see ourselves as caring for the acutely injured. Mm-hmm. And this isn't a very different description of anyone in medicine, really, right? That we look at ourselves as dealing with these acute things that if we prescribe a medication or prescribe a home exercise plan or do a little bit of manual therapy or just give this quick nutrition fix, that everything will be better real soon here. And that was true when we were treating those people. But, many of the conditions that we see, the people that sit in front of us are dealing with pain and dysfunction that are manifesting from something that's much more than a trip on a curb or some kind of gunshot wound kind of thing that you would have in war. And our practice patterns just are not, we're still like we're practicing with those acutely injured people. And so much of the discomfort around moving towards the chronic care side of things, the people that have behavior to change, is that behavior is hard to change. It's so much easier to look at a musculoskeletal issue and say, if we do this quick set of exercises for the next 12 weeks, you'll be all better. You'll get back to the place where you were before and you can move on with your life. People don't even seek care to think about what goes beyond that, really. They just want to deal with the pain that they have in front of them. So I know that kind of jumped around to a number of barriers. I think some of it's our training and the way that we view ourselves. Like I said, we have a value problem. Some of it is the way that because we've defined ourselves as people who treat musculoskeletal issues or movement system issues, that's the way that the public perceives us. And when we try to do anything different, they're surprised. We don't have the language to even say how we do that or the practice pattern for it. So I'm generalizing a lot right now, and I think painting with a pretty broad stroke, but I would say that generally this is the problem that I see when we get started with a new group of therapists, that they just have never thought of themselves in this role. Their patients don't see them that way. And it feels really uncomfortable to step out of what that feeling is that we currently identify ourselves for, even if it's not the thing that probably could help the most of our clients. So hopefully that was a good start to answering that question.
Yeah, well, it's complicated, right?
Yeah.
There's no, if there was a succinct answer, we're probably not sitting here talking about it because we've already solved the problem. I think what I'm struck by, and I've heard many people articulate this just as you have, is medicine does a really good job of defining scopes of practice, which I think is appropriate. but it's also a rate limiter. And we put people in boxes. And you said something earlier that literally popped into my head almost at the time that you said it, which is you were treating his shoulder and you really need to be treating the whole person. And I think that's the thing that we forget about sometime in medicine and in wellness is that, whatever the person's coming to us for, that's just one part of the whole. And if you don't address the whole, then fixing the part, and to go back to the war analogies, it's a Band-Aid on a gunshot kind of thing. So it's complicated. Now, what I'm curious about is with any complex problem, you have to find a place to start. And obviously you're living this with what you do right now. Where do you start on your end when you're trying to integrate a more holistic practice model into a new clinic?
Yeah, that's a great question. I think I'll answer that from, as if we're having a new encounter with like a new client who's presenting with, let's say, an orthopedic issue of some kind. So how we would approach that encounter. I think the best answer to start with is really like, we say that our role is different. I mean, we'll say and really start our practice with just a different approach. The first person that you're going to see is an exercise specialist, and they're going to take some basic health vitals with you that maybe you're done in other clinics. But when health vitals are taken in physical therapy, we do that really just to make sure, is this person safe to get started with us? Are they having an acute infection? Do they have a blood pressure that's unsafe to exercise, or frankly unsafe, period? And once we check that off the list, we look at it and never think about it again. What I believe in doing is we need to take those vitals and then have a conversation with people about how, not just the physiologic state that they're in, the metabolic state that they're in from a health perspective, but how the behaviors that they have, and certainly we'll ask questions and have an intake form that's a little bit different as well, that asks questions about lifestyle, specifically just like the basic lifestyle stuff. Are you eating fruits and vegetables? How many minutes of exercise do you get per week? So getting a physical activity vital sign on everybody, asking questions about sleep and stress, just so that we don't miss that stuff, and giving people a chance to elaborate on that as well. But we take responsibility from the get-go that this is going to be a different experience, that, certainly I want to be here to help you get through what you are intending to get through and experiencing physical therapy. If you are dealing with an orthopedic shoulder issue, I want to do the absolute best job that I can to care for that. However, it's a bigger picture than maybe you've experienced in other places before. And here's the difference. If you're in a state of metabolic dysfunction, that might be contributing to the injury or chronic issue that you are dealing with. We're going to take on having that conversation sometime in the first 2 visits. Mm-hmm. We're going to ask questions about that questionnaire that I was just citing that asks people about their lifestyle behaviors, and just see where they're at in terms of readiness and confidence to make changes there. Is that something that they're actively thinking, along with doing this, I'd really like to turn things around from my exercise perspective. I'm one of the 2 and 3 people that is not physically active right now. And I've really thought that if I was just a little bit more active, if I could get started on something that I'd be able to not get injured so much. I'm really tired of being injured is something that I've heard a number of times. And we just take responsibility from the get-go. I think, from the practice side, it's teaching therapists to have that model and be prepared to give that information. What's hard is that it's not only putting on a little bit more of a hat of, do I understand basic health vitals and medical conditions? It also asks physical therapists to know how to have good, meaningful coaching conversations, to ask open questions, to learn the practice of motivational interviewing. So it takes a really specific, different approach. We're honest with our clients right up front. We are communicative about the plan that we're going to give them, that includes potentially, if it's something that they've said they're interested in doing, something that goes beyond 6 to 10 to 12 visits of physical therapy, that if they decided that they want to be involved in an exercise program once PT is over, that we have the resources in a clinic to do that, or that we have the local resource that is the expert in that field to help refer them to, which really is kind of, I guess an additional layer on top of that that I can talk a little bit more about too. But yeah.
Well, I contained myself with the first part of your answer that almost caused me to jump out of my chair, which was you said that the first person they meet with is an exercise specialist. They come into a physical therapy clinic and the first person they meet with is not a physical therapist. It's an exercise specialist. And I find that to be fascinating and very encouraging. And I want to spend a little bit of time talking about that because again, the Wellness Paradox podcast is all about how we improve the standard of practice of fitness and wellness professionals to get them to be a part of the healthcare continuum. And in this specific context, they are literally a part of the healthcare continuum. And so in saying that, what do you look for in these exercise specialists that are in your clinic? What qualities, what education, what type of person is this?
Yeah, good question. So in order to do that role, I mean, this is something that to take health vitals and to be able to ask really just open questions about what people are hoping to get out of their experience. That's something that is so intuitive to have that exercise specialist do, because eventually we hope that physical therapy rounds out with them right back sitting in front of that person again. In terms of what that person needs to have in order to be successful in that role, there's obviously some, intangible, like, can you have a conversation with someone? Can you introduce yourself well? Do you have, some basic information and education on health vitals? But what makes people really effective is, one, collaboration with a physical therapist, understanding what a PT does, and I think one of the things that we've experienced in having PTs and exercise specialists in the same clinic is something that I've talked to Jeff about too, is that there's almost this, like, I would say it's yucky, but it's this hierarchical thing that happens where we start to compare ourselves based on highest degree, and it's totally unproductive and unmeaningful. We serve different roles. So let's chuck that out the window right away. And it's something that they need to learn. I would never expect that an exercise specialist comes in knowing that they need to view themselves as an equal to someone who might have a doctorate degree, but they need to be able to learn that, take responsibility for it, and understand the uniqueness of their role because it's essential in our practice. And, beyond that, being able to collaborate with those people, to be able to push back when they know that a recommendation for exercise would be beneficial and the PT is hesitant about giving it. Just being able to have that collaborative relationship, to advocate for a client to move that direction. I mean, that's the stuff that really gets our exercise specialists to be effective at getting those clients to move through the continuum and end up in an exercise program. Then, of course, what really helps us maintain trust with those exercise professionals. So, I mean, I practiced in this model. The people that I trusted that I'd hand any client off to blindly are the ones that are doing safe prescribed exercise that it's effective. I know enough about exercise to know when I look across the gym and see somebody doing sideways walking with a slack band, and that's your glute strengthening exercise, that's not cutting it. So we're going to have a conversation about what you're trying to do there. And you better be able to explain it to me. It's probably not unsafe, but it's probably not super effective. So yeah, I mean, the thing that keeps me referring, if I have an exercise professional that I'm working with, is that they have learned what it means to have safe and effective care and really have built trust with me. I mean, if there's one thing, even just walking away from this whole conversation today, Mike, like, if there's one thing that I can say that's going to help us get there, it's that we can build relationships with each other, help us define each other's roles, and build trust amongst medical providers who are trying to work to the end of the same means. So that's what it takes to collaborate. I think most of that stuff can get learned on the job if you have really good education to start with.
Yeah, what you said there, I think, is so critical about the mutual respect between the exercise specialist and the physical therapist. And there isn't a pecking order or a hierarchy. It is just different roles and different responsibilities. And I think obviously your model creates that type of collaborative and trusting culture in those little micro communities. And I think that's a really interesting model to consider how to replicate, because it's just not the technical training. It's also the cultural element that allows that to become a reality. That's interesting. I'm curious, when you present this model to a prospective clinic or group of clinics, is there pushback on this, or are people excited about it? I'm sure there's elements of both.
Yeah. So, my profession has changed a lot in the last 10, 15, 20 years here. What I've learned is, and I think probably the greatest challenge to my young career, especially in consulting in this stuff, has been the immediate enthusiasm of people who hear the message, they believe. I mean, nobody's going to disagree with the idea that we should treat our clients as a whole person. Like, nobody's going to fight me on that. Nobody's even going to fight me when I say there's a good chance that there's metabolic factors and behavioral factors that might be influencing the reason that people show up to our door. Nobody's going to fight me on that. They're all going to celebrate it and say, yeah, that's good. That's great. Knowing the difference between the agreeable, yes, I believe that too, and the I'm willing to put that into action has been really difficult once we start working with someone. And I think a lot of that is, how much time am I willing to dedicate to watching when someone says, yeah, I understand, and then go back to the same practice. It can never be for me. And that's why I have a role in doing this. You can go to a Con Ed course and hear me talk about this and go back to doing the same practice because, yeah, I hear it. Yes, I agree with it. I have no idea how to implement it. So I'm going to go back and try my best, but I'm probably going to do the same things I've always been doing. And it's really at that stage, once we've gotten past the honeymoon, if we all agree on that this would be the best practice of doing it, that we start to get pushback. And that's the fun stuff, man. That's when I get to start to get my hands dirty and really start to give people the tools that help make practice change. So that has been a good challenge for me, but I really think certainly has also been the place that I found my value too. So yeah.
Yeah, enthusiasm is always high whenever you bring up something initially, especially something that is as undeniably beneficial as what we're talking about here. But it's ideas are plentiful and execution is limited. And I think that's what you run into. One of the things that strikes me with this, and I don't want to go too far down this rabbit hole because we're not a physical therapy podcast, but the thing that I find interesting here is the business model implications to this. This is a way to, in a climate where insurance reimbursement is continually diminishing and out-of-pocket costs are going up and so on, this seems like it can have substantial impact on the bottom line.
Yes, it does. I don't even know there's not a whole lot for me to even add to that. You're right. When we crunch the numbers and really figure out if a clinic was efficiently making referrals to a prescribed exercise program or was incorporating care with an exercise specialist, we strongly suggest in any of the clinics that we work with, really make implementation necessary of this program that we call Bridge, which is integration of an exercise professional into the plan of care. And I'm not talking about a PT aide that we call an exercise specialist who just extends a visit with a PT. I'm talking about a separate individual session with an exercise specialist while someone is also in physical therapy care that is really, it serves so many purposes. If you think about the number of people that don't do their home exercise plans, if we could improve our HEP compliance, that getting people to do the exercise that we think is going to help them just with their acute need, period, that we'd have better outcomes. That if we were able to get people to start to be active and build relationships with exercise professionals during their plan of care, that they'd be more likely to continue on to a prescribed program with that same person. You can start thinking of like how the dollar signs start to add up if you get people integrated in the exercise side of this and have some really good, competent exercise professionals that can retain people that they work with in effective ways. You're totally right. There is a business model in which this works.
Yeah, it is interesting, and certainly in the insurance climate that we're in right now, it
Yeah.
seems to even be more interesting. Well,
Yes.
I want to stay on the exercise professional side of this. I want to kind of keep pulling on that thread and talking a little bit further. The first thing I want to talk about is something that is an often said, I guess, complaint of physical therapists amongst exercise professionals.
I
And
love it.
you're smiling, so you may know where I'm going with this. Is that many exercise professionals, and this is a very broad statement, don't like physical therapists because physical therapists will tell them when they're injured not to exercise. I think that's the generalization in our industry. So, like, speak to that from the physical therapy perspective. Let fitness and wellness professionals look under the hood, because my perception is that people think that, but that's actually really not the case categorically in terms of what's going on. But you hear about it, so I'd like to hear you address it a little bit.
Yeah. So I have to say that when I speak as if we are where I want us to be as a profession, right? So I'm going to speak that way, and I just want that to be the caveat that's said here. But I really believe that most physical therapists aren't giving that advice anymore. That the rest because you're hurt kind of conversation. Now, what I will say that I think we need to improve on is, so you're hurt in this particular area and you're going to have a limited ability to do really the exercise that we consider to be super effective for improving health, right? That good strength training and cardiovascular training, that's really the stuff that we would say is medicine. Mm-hmm. So let's say that we've got somebody who just had a total knee replacement. Is that somebody that can't do cardio for the next 12 weeks? Heck no. And what I know we need to get better at, period, is if there's not an arm bike or something in your clinic, even a light cardio program that you can get this person on, if there's not upper body strengthening and even like appropriate lower body strengthening stuff that we can do with those people throughout the rehabilitation plan of care, once they've stopped being in, such an acute inflammatory state, that's like really total knee replacement's tough surgery. Yeah. But once we get beyond that phase, if we are not working people out, like, I wouldn't let people leave without a sweat unless there's a serious reason that they couldn't leave without a sweat. And I believe that our practices as physical therapy are moving that direction. Now, that doesn't mean, and I think there's a little bit of confusion in the PT world. Unfortunately, this is my opinion and what I've seen. But even, the language of exercise is medicine. We prescribe exercise to help fix acute issues. Mm-hmm. And I really don't think that's, to me, that isn't what exercise is medicine means. I mean, that's nice exercise that helps people deal with their pain, but really exercise is medicine is, am I providing the stimulus to build strength, endurance, to help people with those labs that really are like the things that help determine whether someone's in a state of metabolic dysfunction, help people improve their mood, all the things that we know are like the true benefits of prescribed exercise. We're not good enough at getting people connected with that. I 100% agree with that. I think we're moving that direction though, as a profession. It's one of the things that I've been really heartened to see as continuing conversation. Like I said, I'm a member of the private practice section. Jeff and I are going to speak at the combined sections meeting this year, the kind of big physical therapy conference on this same subject too, of getting physical therapy to be a part of really that prescribed exercise for more than just broken body parts kind of idea. Like, we need to continue moving that direction. There's a reason that I get to go talk about it, and it's because it's not common practice for everyone yet. We just need to keep moving that way. I think we're on our way there though.
Yeah, it seems like it. And I would agree. I think we're all starting to realize the importance of this holistic care model. And I think there's a lot of things driving that. Where I want to go next with this, because I'm a firm believer that substantial change happens both kind of top down and bottom up. And
Sure.
There's certainly a lot of top down things that need to be done. And Kate Collins and I talked about that on her podcast. Yep. But the thing that I really admire about somebody like you and somebody like Jeff is that you guys are kind of bottom up. Like, you're on the front lines, you're out there fighting this fight. And to that end, what I want to talk about now is your view on how exercise and fitness professionals can start to develop relationships with physical therapists in their community, because not everyone's going to have the luxury of Thomas walking through the front door of a PT clinic and saying, hey, we need to hire 5 exercise specialists. So talk about, from your perspective, how you think exercise specialists in communities can start to develop these relationships with physical therapists.
Yeah, man. So that's such a good question. And, I think Jeff is really good at speaking about the, like the barriers to getting people to send referrals to exercise specialists. In fact, I think he probably knows more about that than any one person I've ever met, or any combination of everyone I've ever met. That's been his life up to this point, I think, in figuring out that and how we can elevate fitness professionals to be that group of people that serves the medical community. I think one thing that I've even felt as a frustration is that, if I go and speak to a group of kinesiology students, 3/4 of them think they want to be physical therapists, and that's it. I think any platform that I get a chance to talk to, especially if fitness professionals are listening, here's what I'll say. There is a role for you in medicine. Like, don't look beyond your fitness degree to think that has to be the end all be all. There is such a valuable role in medicine for the clinical exercise specialist that is able to help people get started with prescribed exercise that's meaningful and good. So just the baseline of that is where I want to start with this. Beyond that too, in building relationships with physical therapists, I was thinking about this a little bit earlier. I was trying to think about, especially as a PT, if anyone had ever asked me what I would find meaningful in sending patients to an exercise specialist. Like, if a fitness professional has ever come up to me and asked me that question, certainly before I was in this role, because I get that question a lot now. I really think it's so little, Mike. It's so little. If you stop me and said, hey, I want to have lunch today, and I want to talk to you about like what you think the role of an exercise specialist could be in your practice, or like how you would like to see people exercise differently when they get done with PT, I would have lunch with you, and I'd probably ask you to go to dinner afterwards too, because I want to have that conversation. And I may not be the normal PT. I recognize that, but I guarantee you that if you ask 10 PTs, that you're going to find somebody who wants to have that conversation. And even just one referral source, even just one PT who's consistently sending you people who have started an exercise program, like they're already starting a behavior change of exercise. So they're kind of bought into like, oh, this movement thing might really help me. Man, if you can build a relationship with that person, just sit down with them, learn what it is that they really care about. And for us, if I knew that someone was going to practice with my clients in a way that was safe, that reflected, at least to some degree, what I was saying with them, that was kind of continuous with my same message, I'd send them all day. I'd close my eyes and send them that way, because I believe in the power of exercise, and I believe in the people that I build relationships with. If I trust them to make the referral, yeah, that's really it. I just think it's so much of it is just making that connection. Find someone in your area that is practicing. There's PT clinics all over the place. You'd have to be really far out there to not have a PT clinic in your hometown. Go see what that person's about. They may not be practicing a model that's really conducive to sending clients to exercise, and that may not be your thing, but go find one that is, because I guarantee there's one close to you.
What you said about just finding one physical therapist, I think it's so critical. And this goes back to something we talked about with Kate Collins on her podcast, the idea of you don't need to find 15 primary care physicians because of the number of patients one primary care physician will have. The number of people that move in and out of a physical therapy clinic, just one single clinic over the course of a month, is significant. And even if you are working with a small portion of that population, you're almost going to have more business than what you can handle as a solo practitioner. And I think it is a numbers game. You do have to talk to probably a decent handful of people to find the person you connect with. But I think what you said there just needs to be, feathered out, is that, go in, have the conversation, see if they're willing to talk. And eventually, someone is going to be like you, and it's going to pique their interest. And I think sometimes as fitness professionals, we just don't put ourselves out there in that fashion.
And I do want to say, I know that I made it sound easier. Like, even just in reflecting what I just said there, I know it sounded easier than it actually is. There's people out there that are trying this that probably are shaking their heads at me like, man, Thomas, I've tried this thing, man. You don't understand these PTs. They don't do it consistently. They'll do it for a little bit and then they stop. Mm-hmm. And I know that there's some things that that make this more challenging. Again, this is stuff that Jeff talks about, but if only we had an electronic medical record where the exercise professional was consistently integrated and we could communicate that way. I really do think when it comes down to it, it's the consistency of engagement and communication with someone who's a referral source. If that's what you're living off of, it's got to be the way that you do it. I know that it's more challenging than what I made it sound like it is, but at the same time, it's how you make this thing work. And if you build a reputation as that person, there is no doubt that you can build clientele just from this pathway.
Yeah, absolutely. And you have to start somewhere. The reality is it's far from a perfect system right now. Again, if it was, we're not sitting here having this conversation.
Right.
I am curious, as a physical therapist, and with what you said about electronic health records withstanding, which is that there is an integration for fitness and wellness professionals. As a physical therapist, how interested are you in getting feedback from the exercise specialist to you or to one of your physical therapists in terms of progress of a patient?
Yeah. So, and, this is really, if we go back to what I was talking about before, some of this stuff is that I think PTs are, I don't know that we ever, if I reflect on the people that I worked with, I don't think there's ever a point where I discharge someone and think, wow, I'm glad I don't have to think about that person anymore. I really, if I spend enough time with someone that I get to know them, I want to make sure that they're continuing on a path that is towards prosperity, right? Like towards a better, healthier life. Like I work with people so that they can go back and do the things that they really care about, so that their body allows them to participate in the meaningful things of their life and even more, right? So that they can see the opportunity that their bodies give them to have meaningful lives, that like we can do hard things with our bodies. Like that's what it means to be a physical therapist, I think. And I kind of lost track where I was going with that. I'm
actually happy you lost track, because the direction you were going was actually kind of get me fired up. But what I was saying is the report back from the exercise stuff.
Yeah, sorry about that. So the report back, I do care. And I think what I was saying earlier about let's throw our credentials out the window. I don't care what position you are. If you have something important to tell me about the person that I was working with before, I would love to hear it. If you're doing something that helps bring more meaning to that person's life and is helping them add life to their years, like I want to hear about it. Tell me about it. I want to know. And especially if things aren't going right. I mean, that's how I get clients back in the door myself. I want people to be engaged in things that challenge their bodies. Sometimes that means that things don't go 100% right, and they may need to come back and see me for a few visits, and that's fine. But if that's as a result of doing something that improves their health and gets them stronger and helps them do more than maybe they even imagine, then I of course absolutely want to hear from the people that I collaborate with about the clients that I have referred there, for sure.
Yeah, it's so important. And I'm just, in my mind, I'm trying to lay out a framework here for the fitness professionals that are listening that are interested in this. Say, hey, what are the requisite components of what I need to do to be a viable referral source for physical therapists? And I could keep going deeper and deeper and deeper on this, but I want to be respectful of your time and our listeners' time. So I got a couple of questions that I want to bring this to a close with. Yeah. The first one, because I'm one of those people that try to look at the world from a very optimistic and appreciative perspective. I always like to ask this question: what is it that gives you hope for this exercise as medicine movement, for lifestyle medicine, based on what you're seeing?
Yeah. I do love that question. And I think I'm really fortunate to do a job where I get glimpses of that hope like every day. And even when it's hard, I get glimpses of the hope, because if it was easy, it wouldn't be worth doing it. Um, I really think what brings me hope, and you talked about, I'm at the level where I'm seeing on a pretty consistent basis the people who are delivering this care and interacting with how that process can improve. I am heartened on a consistent basis with the facts that medicine is a really hard place sometimes to practice in. Certainly right now, it's not easy. And there are people that come to work every day rejuvenated, feeling like they can practice better, that they have more resources to give to people, that the care that they provide there matters, and that an approach that is harder. It undoubtedly is harder to do what I'm talking about doing, to take more responsibility, to collaborate with more people, to have a bit more of a complex system, that for the people that are able to stick with it for long enough, that are able to get through, oh, this is kind of hard, this isn't exactly what I was expecting practice to be, that it seems to heighten beyond expectation what it means to be a medical provider in this therapeutic sense. And I'm very heartened by that, and hopeful that that this kind of practice will continue forward. The other thing too is that when we play the numbers game, there's too many people to serve with the number of medical providers we have. I'm really heartened by seeing some of the technology that is coming out to help serve people at the right time. And that there is seemingly a movement. I'm certified in lifestyle medicine by the American College of Lifestyle Medicine. I see that there's an interest in the public. There's certainly interest as medical providers to move our practice to be more preventive. If you start playing the numbers game on a big scale medical perspective, that if we really tried to build a medical system that served 7 out of 10 people as being those people that are dealing with some kind of metabolic dysfunction, you just can't do it. So it takes getting on the other side of it and focusing on prevention and empowering people to be more preventive. And I just see that happening in different ways, whether through technology, through advocacy, through policy. I'm so heartened to see it happening at that level as well, and to see what that does for medical providers at the level that I tend to practice at as well. So I get a lot of that hope, and I appreciate you asking the question.
Yeah, there definitely seems to be significant momentum behind this. And I've talked about this in several episodes. We also are at a very unique inflection point in the health of our country, in the sense that this is the first time with COVID, we've ever had an acute medical condition that was so greatly exacerbated by chronic disease. And I hope that we don't waste a good crisis in that respect. But yeah, there is a lot of hope there. Well, Thomas, where can people go if they want to find out more about you and all the stuff that you're doing?
Absolutely. So the first place that I will point people towards is Pinnacle's website. So pinnacle-pt.com. My bio is there, as well as some information about what it is that we do. I'd also point you towards mrfinstitute.com. Jeff and I are putting together some resources. So Jeff Young, my colleague and fitness professional guru, this guy, man, has opened my brain up to a lot of how I can see. Sometimes you see through the fog towards where you want to get to, and it's real foggy. And Jeff he's helped clear a lot of the fog for me in terms of the how from a fitness perspective. So I feel really fortunate to be getting started with him on something that will bring information to people who are interested in implementing this model, particularly on the fitness and rehab and medicine side of this thing, to get people more active. A lot of my focus is around behavior change. Believe it or not, as impassioned as I am about getting people to be more physically active and doing the right kind of physical activity, I care a ton about how we have those conversations with people and how we catwalk to get them there. So that's a lot of the stuff that I will intend on contributing to that site. That's mrfinstitute.com. And lastly, yeah, I don't know. I probably won't point you towards my social media right yet, but those are two really good places to find me: Pinnacle PT and MRF Institute.
Well, and we'll link up to both of those on the show notes page.
Perfect.
For sure.
Yep.
Well, last question that I always end the podcast on is very specific to the mission of our podcast, which is, this wellness paradox, as I define it, is the lack of interaction and communication between fitness professionals and medical professionals, which ironically enough, you were actually going head on to trying to address that. But if you were to leave the exercise and fitness professionals that are listening to this with one piece of advice is how they could start to close off that gap, what would it be?
Yeah. So if I was to leave the exercise and fitness professionals in particular, a piece of advice around that, I feel like I've been preaching at those people for a lot of this podcast too. And in a lot of that vein, what I do want to say and reiterate as before, there is a need, man. Whether it exists today at this point, or it's going to exist 6 months from now or 12 months from now, there is a need within medicine and right on the boundaries of medicine where inevitably, if we move to be more preventive, if I take responsibility as a physical therapist to help my people get connected with movement better, I'm going to start referring to people. And so are my colleagues. And so are other medical professionals that I talk to quite a bit. We need good people to refer to. If you're out there feeling like, man, I don't know if this pathway is going to work for me, I got to find something else, just stick with it. Like, I really believe that that this medicine to fitness pathway will take off. I really believe that we'll start to have, and I think nutrition's had a little bit of this blow up recently of a refocus on what we can put in our bodies to be healthful and prevent disease. And I think that I'm really hopeful soon. I actually feel strongly about this, that just a little bit longer and a little bit more of the right language will come out to show people that fitness is going to be that thing as well, and will be promoted as such coming up here pretty soon. Stick with it. If you're a fitness professional, find your people to collaborate with. I really, if I could make one message to any person who's out there trying to do this, it's like, find somebody who you can build some trust with, like really just like trust and love other people, man. Like learn about somebody else, get to know them at a level where they feel like they could have a relationship with you. Like, that's really what it takes to make this thing work. And something that I think in medicine, unfortunately, especially if you're not integrated in medicine yet, it's not exactly the warmest reception all the time when you try to get started with the medical community. But I think can be, and certainly could be, something that fitness professionals can bring to us too. So stick with it. Love people, build relationships and trust. It's important. We need fitness professionals to be a part of or sitting right on the edge of this medical paradigm. And I feel, again, strongly that it's going to be that way here.
Outstanding. Thomas Hammett, thank you so much for joining us.
Mike, it's been my pleasure, man. I appreciate it.
Well, I hope you enjoyed that conversation with Thomas as much as I did. If you found it insightful and informative, please do share it with your friends and colleagues. Those shares make a big difference for us. Any additional information that we'd like to share from this episode can be found on the show notes page by going to wellnessparadoxpod.com/episode 24. Please be on the lookout for next week's episode when it drops on Wednesday. And don't forget to subscribe through your favorite podcast platform. Until we chat again, please be well.